Well, welcome everyone to Dialogue. The newly emergent COVID-19 variant Omicron has triggered global alarm. The World Health Organization recently saying it's likely to spread internationally, posing, quote, a very high global risk where COVID-19 surges could have severe consequences in some areas. So what do we know so far about the new variant? How big of a threat is it? And what impact will it have? Well, to discuss all of these issues and more, I'm joined by Dr. Christopher K.M. Hui, specialist in respiratory medicine of the HK COVID-19 Task Force. Dr. Alice Hyun-Kyun Tan is an internist at Ms. Medi Women's Hospital, who joins us from South Korea, and Dr. Mohammed Munir, virologist and lecturer in biomedicine health and medicine at Lancaster University, will join us later on in our program. That's our topic. I'm Michael Wong. Dr. Hui, I want to begin with you because the Omicron variant, of course, has been classified as a variant of concern by the WHO. But as of the last update by the WHO on November 28th, we just simply don't know much yet about whether it's more transmissible or if Omicron causes more severe disease. So I'm sure you've spoken with the science and medical community since then. Do we know anything more about Omicron as of today?
Thank you, Michael. We do know that it is a variant of particular interest. The genetic sequence that alters the changes on the spike protein, which allows the virus greater access to human cells, suggests that there may be a concern about greater transmissivity from person to person. Now, it's very early days yet. Of course, we don't know entirely the numbers or the epidemiological data in real terms, but we can start to see the trends in certain parts of the world where we're tracking this new variant to see the numbers rising over time. And if you look back at earlier months last year, when we saw with the Beta variant and with the Delta variant as well, this was a very similar pattern, and this is why this variant is of interest and of so much concern.
Yeah, and we need that data. We're currently sifting through all of that data right now. Dr. Tan, what do you think is the likely timeline perhaps for when we will know more information? Is it likely in a few days, a few weeks, or maybe a month or two?
I think it's in a matter of days and weeks. In terms of the early epidemiological data coming out of South Africa, certainly in terms of transmissibility, we know that it has overcome the dominance of the Delta strain, especially in the Gauteng province of South Africa. We know that cases have really soared in terms of daily COVID cases, especially in that region. I think in November 8th, they were logging 116 cases, and by November 30th, they were above 4,000 daily COVID cases, the majority of which are thought to be of the Omicron variant. So this trend is, of course, very concerning in terms of transmissibility. But in terms of the virulence data, we're still, I think, awaiting epidemiological and also laboratory evidence. In terms of hospitalizations, there might have been a slight increase in the last few days in terms of hospitalizations in South Africa due to COVID-19, but the case fatality rate for COVID-19 throughout the month of November has been fairly stable. So, I think we do need to delve deeper into the data, sort of weed through the specifics to try to get more information. But probably the timeline I'm looking at is a few days to few weeks before we know more. What's coming out of Europe is also at the forefront. It's at least reassuring. They said that of all the cases of Omicron variant for which we have information, the cases have all been mild. There have not been any severe cases or fatalities reported out of Europe yet. So initially, there is a bit of sigh of relief, but this is what happened. This is the two faces of COVID that we've seen many times. We have the asymptomatic and mild side, and then of course, for the high-risk population, it can lead to very severe disease and even death. So I think we do need to wait before we make any conclusions.
Yeah. Okay, but as of now, fatalities from COVID-19 in November pretty much stable, and then as of now, also milder symptoms we've seen from Omicron. But again, we do need to wait for that data to come out. Dr. Hui, you were talking about the spike protein, and that new variant contains more than 30 mutations of the spike protein that viruses use to get into human cells. That's double the number of Delta's spike protein. Does that mean it's more dangerous than the Delta variant?
Potentially. So we have to understand these things in the context of evolutionary science. The genome of the virus is constantly tumbling, it's constantly finding new variations, and it's looking for new wild types by selection pressure, by a process of selecting out the fittest versions of the virus for survival. So if we think about it in those terms, well, the virus replicates every 15 to 20 minutes in a human cell. The issue is we only replicate once every 20 or 30 years. And so really, in terms of speed, the virus has a huge advantage on human beings. And so when we look back at history, we know that viruses have been with us for millions and millions of years. And they are very powerful in evolutionary terms in this context. And this is what makes them the virus so dangerous potentially, because what it cannot do today, it may be able to do tomorrow.
Yeah. Dr. Tan, Moderna's CEO says current vaccines may be less effective against Omicron, but you also have health experts saying existing vaccines may be able to continue to provide adequate protection against severe disease. Where do you stand on this in terms of the tools that we have right now? How effective can they be against Omicron?
Well, of course, because of the large number of mutations in the spike region especially, that's why we're concerned about immune escape due to vaccine-induced immunity, and also, of course, natural immunity after natural infection. And so that raises the risk of reinfection. I think, though, the best bet that we have to protect our most vulnerable groups, and of course that's a priority always, is to prevent death due to disease. And the best way to do that right now is to make sure that our vulnerable groups are well protected in terms of their immune status through full vaccination, and when they're eligible, making sure that they get their booster shots. And so I don't think there's really any debate about whether or not we should proceed with a booster campaign. I think, Delta is still the dominant strain right now, and we still need to booster against Delta. I think the best strategy for preparing against Omicron is making sure we have good protection against Delta, and that would be through the boosters. Of course, if it turns out that vaccine effectiveness against serious disease and death goes down due to the Omicron variant, then we may need an updated version of vaccines in the future. I know that Pfizer, and you mentioned Moderna, they are working right now on developing revised versions of their vaccines. We may be seeing them in early 2022, so we'll see. The jury's still out on this one as well.
So Dr. Tan, how quick is it for pharmaceutical companies to really have an updated version of that vaccine to battle new variants?
Well, according to the CEO of Pfizer, his timeline was 95 days pending regulatory approval for when a updated version of the COVID-19 Pfizer vaccine could be available on market, which is quite remarkable. But he stated that their company actually did have a revised version against the Delta variant as well, and they were making it at risk. But the assessment was that it was not necessary to deploy that new formulation, and so it was kept on the shelf. And that's what they're doing right now. They are in the process of making a revised vaccine, and should it be deemed that it is necessary to protect our most vulnerable groups and also the wider population, then that's when it will be submitted for approval.
Dr. Mohammed Munir, virologist, joins us now as well. Dr. Munir, great to have you on the program. We were discussing about the significance of Omicron in terms of what else we can do to protect our societies and people from this new variant. The U.S., Australia, and others, of course, already imposing travel restrictions on flights from South Africa. We hear Japan, Israel, Morocco have all barred foreign travelers from entering the country as well. Do you foresee more countries following suit in terms of much stricter travel restrictions?
Well, I think what we have learned from the Delta variant is that when these new variants, which likely are more transmissible, enter into a country or the continent, they are very difficult to contain. And for example, Delta variant, when it entered into the Europe, I mean, it moved within a month to almost all European countries, and now it is the most predominant strain. To avoid such thing happening again, I think the only thing one can do is to really reduce the possibility of new variant introduction into the country, so that we can buy the time to understand those questions that we don't have answer yet for its transmissibility, vaccine escape, or reinfection potential. So at the moment, I am seeing that there is quite a bit of fear around this one, and this fear will carry on expanding, and more countries when they start reporting new cases, but not necessarily the travel ban gonna put a barrier against this variant. Once it is into a continent, is around the globe.
But Dr. Hui, Hong Kong, of course, has also detected Omicron variant cases, but the SAR has prevented the local community spread of the virus. So what is Hong Kong doing to further strengthen its vigilance against Omicron?
Well, I think locally we're very alert to the possibility of import cases. And so even during quarantine, individuals are tested serially. Obviously, this takes a lot of work to track and trace infection, but I think it is a necessary component of public health controls in the territory. It's difficult to close the gates after the horse has bolted. I think travel bans internationally are effective, and that there is a method to controlling transportation and transmission of the virus. But at the same time, we have to consider that potentially we're closing the gates sometimes after the virus is already in. That hasn't happened in Hong Kong so far. With the sort of pandemic over the last year and a half, 2 years, we have seen 12,436 cases in total and only 213 deaths. So in a city of 7.5 million population, we've been very fortunate. But again, there are huge sacrifices on the counterbalance. This comes at a great cost in terms of economic activity and social activity. And so I think these are perhaps more political or socioeconomic decisions that have to be made.
So Dr. Hui, do you think Omicron may impact the planned reopening of the border between the Chinese mainland and Hong Kong?
I don't know. I think in theory, to my mind, it shouldn't necessarily, because both mainland China and the Special Administrative Region, the SAR, have adopted essentially the same set of policies and controls. So there is consistency. When we look around the world now at different countries, basically we are divided into those who believe that perhaps there's some possibility or room for coexistence with the virus. And then there are those countries that still believe that zero COVID is a necessity to provide protection for a very large and very densely populated environment. And one of our closest comparisons for China would be India, and we could see what happened in India in April.
Dr. Tang, I want to understand maybe the situation in South Korea better, because South Korea reporting as of Wednesday that its daily coronavirus cases surpassing 5,000 for the first time, and we have suspected cases of Omicron in South Korea. What's the latest where you are?
Right. So we have 4 suspected cases of the Omicron variant. They have undergone genetic sequencing, and the results will be out probably within 30 minutes. We will know if these people are carrying the Omicron variant. 2 travelers came from Nigeria, and they seem to have passed the infection on to family members and a close acquaintance. So we'll see if Omicron has already landed on our shores. In terms of the COVID-19 situation, overall, the South Korean CDC has assessed our risk level as very high. And so that is the highest level on a 5-level system, both in the Seoul metropolitan area and also throughout the country. So November 1st is when we started our stepwise return to normal, which is our exit strategy from COVID-19. We had achieved a full population vaccination rate of 74%, and many of our restrictions were lifted November 1st. We did anticipate, with the lifting of many restrictions, that there would be an increase in transmission in the community. That was something that we expected. What we did not expect was the huge increase in hospitalizations, severe cases needing ICU care, and the increase in deaths that we've seen in the 4 weeks since November 1st. And so this is why we decided to put off progressing to the next stage of the so-called stepwise return to normal, because the situation has become so strained in the hospitals right now. It really is unsustainable. Hospital ICU occupancy in the Seoul city proper is greater than 90%. For anybody who knows what a hospital situation is like, 90% is the same as 100%. Basically, our ICUs are full, they are saturated. And so that's why we are trying to ease the pressure on our healthcare system right now, and trying to decrease transmission overall in the community. Right now, our effective reproductive number is 1.19, which means that COVID is still spreading in our country. And so we are trying to take measures without going backwards too much to try to control COVID in our country.
So, Dr. Tan, South Korea is rethinking perhaps a little bit, because right now South Korea has chosen to go with coexisting with COVID strategy. But like you mentioned, perhaps it didn't expect such an explosion of new coronavirus cases and the burden on hospitalization in hospitals overall. What do you think? Will there be really a big step back in terms of coexisting with COVID right now, or do you think maybe just a gradual or a minor one?
So I've been calling it our fatal mistake, both literally and figuratively speaking. We did not, I think, take enough measures to deal with the issue of waning of immunity, especially in the elderly groups who received their vaccinations early on. So it's already been about 8-9 months since they started their vaccinations. And in these elderly groups, over 60 years old, their immune levels have decreased so much that we're seeing large numbers of breakthrough cases. And that's what's accounting for the hospitalizations and ICU admissions and deaths. So the strategy is to really expand and accelerate our booster campaign, especially in people older than 60 years old, people living in long-term care facilities such as nursing homes and convalescent hospitals, because we've seen these facilities have huge outbreaks recently, and they've resulted in poor outcomes for the residents.
Yeah, get that booster shot, get that booster shot, get that booster shot. I don't think we can stress that point enough. Dr. Munir, I want to come to you because some say the Omicron variant indicates another failure of herd immunity. People arguing that just relying on autoimmunity perhaps just simply provides more opportunities for the virus to mutate. What do you think about that view?
Well, that is very certain that whenever virus get the chance to transmit from one person to another person, it will acquire mutation. And if one person is vaccinated and have some level of immunity, other person didn't have it, that is an ideal ground for the virus to mutate. So if we look onto the global perspective, that is the real situation ongoing, where we have some population that is vaccinated, some is naturally infected and recovered, while other population is naive, they don't have the antibodies. So when virus jump between these two different population, that is when it got the immunity. So that's really the point, is that if we want to avoid these mutants coming up again and again, and the variants coming again and again, the global vaccination has to be prioritized. And it's been said so many times, but little action has been taken. I mean, at the moment, if you look onto the number of boosters, the booster doses that have been given in developed world in last 4 months are more than the first dose that's been given into developing countries for the entire year. So that is really dictates how much inequity in there for the vaccine coverage. So until we don't really have this blanket vaccine approach throughout the world, herd immunity cannot be achieved, and these mutants will carry on coming.
So, Dr. Munir, that is an absolutely crucial point. We got to get more people in the developing countries, in lower income countries, vaccinated. Talk to us about the importance of closing that vaccine gap, and why isn't more being done to close this gap? I mean, we're hearing reports of Africa, the entire population being fully vaccinated, somewhere around 6%, where in more advanced economies, they have secured vaccines that can cover their people 3 to 4 times over, perhaps, and with fully vaccinated populations of around 50 to 70%.
Absolutely, and this is very unfortunate because we've been saying right from the beginning of this pandemic that when we talk about infectious diseases, we talk about transboundary diseases that do not really respect the boundaries. And when we talk about COVID-19, which is highly transmissible, highly contagious infection, no country can individually claim the victory until the disease is in control throughout the world. And I think one of the major contributing factors in low access to the vaccine is first is the supply of the vaccine, and secondly is the hesitancy. In terms of supply, when we say supply is not just the vaccine doses, it's entire infrastructure from distribution of a vaccine to the deployment to having enough syringes, to having enough infrastructure in terms of manpower to deploy that one at the scale that is needed to reach at a certain level of immunity within the community. That hasn't been really emphasized. For example, the COVAX program, it does provide you certain level of vaccine doses, but then there are a lot of other questions within the country that need to be tackled. So until those ground realities are not really looked into, the vaccine coverage will remain lower. And then is the vaccine hesitancy in many of the countries because of the misinformation out there. I can personally see that there is a lot of vaccine hesitancy in the developing countries, and then there are arguments even that okay, the countries those have deployed vaccine at that really large scale, they are still suffering at the same level as that is in the developing countries, and that really put the whole pressure onto the society not to take up the vaccine. So that is again a responsibility lies onto the global regulatory or global organizations such as WHO, CEPI, to really come up front and ensure that the vaccine supply is at the level where we can claim the victory altogether.
Dr. Hui, I mean, what do we do about vaccine misinformation? Because we certainly just have a group of people that refuse to be vaccinated no matter what you tell them. In terms of what logic and science dictates, they just still choose not to take the vaccine. And we see this mostly in advanced economies. What do you think? How do we fight this?
Well, I think we can only do our best to educate people and reason with them, to explain to them patiently and fairly why vaccination is so important to the whole population and the immunity of the entire group. I think in my own experience as a clinician, really as medical personnel, we have a duty to share this information, to explain to people, and then to make the vaccines widely available at a minimum cost, if any at all. I saw in the news this morning that China, President Xi has just committed another 1 billion doses of vaccine from China to support African countries and less developed environments. And I think that's a fantastic measure in the right direction. People have to receive the message that, we are here to help each other. It is a constructive process. There has to be a dialogue, and there has to be education in the process. There will be some people who understand differently or who have different ideas, but again, we can only but explain.
Yeah, and like you mentioned, Chinese President Xi Jinping saying that China will indeed provide an additional 1 billion doses of COVID-19 vaccines to Africa, 600 million of those doses as donation, 400 million through joint and local production. And that move aims to help the African Union achieve its goal of vaccinating 60% of the African population by the year 2022. Dr. Tan, what do you think about this goal for vaccination in Africa? Can it be achieved by that point? Because we are starting from quite a low base right now, and as we so often hear, the pandemic anywhere is the pandemic everywhere. It can't just be about the more advanced economies getting vaccinated, but more developing emerging economies as well.
Absolutely. I completely agree with what you just said and with my fellow panelists have mentioned. I think that in the African continent, we need to really zone in on what are the factors that are preventing vaccination from occurring. So even if vaccine is able to arrive in the country, what are the obstacles that are leading to low vaccination rates? And there may be logistical issues, there may be societal issues. A lot of, I think, obstacles are in place over there, and we have to work, I think, with UNICEF, with the Pan American Health Organization, with organizations that are used to doing mass vaccination campaigns and really get, I think, feet on the ground to deliver vaccines into arms. That's what I heard from the Director General of the International Vaccine Institute, which is located here in South Korea, that unfortunately, many of the vaccines that have arrived into Africa actually have gone unused, exactly because there were issues of deployment of the vaccines. So it's not all just a supply issue, it's also beyond supply. And I think those are issues that we need to tackle.
So Dr. Munir, how about we end on perhaps a more optimistic note in terms of what else can be done in our international community to better coordinate health policy around the world to really tame and tackle COVID-19?
Well, I think one thing that is pretty clear is that we have to do a surveillance of new variants across the globe. We have this surveillance facility only in very handful of countries where most of the information that we come up is really the one that train our future strategies. So surveillance is very critical. Sequencing is very critical to really tell us well in time what is coming. But to avoid these variants, again, the same emphasis is that we have to deploy the vaccine at a global scale and also keep looking for any of the revised strategy onto the vaccine itself that needed to be put in place until not everybody is at the same level of immunity, access to the infrastructure. Probably we will not be in the situation to have a good handle on this pandemic.
Okay. Well, either way, we're going to still need some more information in terms of the severity of Omicron, but we need more solidarity on the international stage. And of course, everybody needs to get that booster shot in order to not only protect yourselves, but to protect all your loved ones around you. So that is what we can do individually as well. Thank you so much, Dr. Munir, Dr. Tan, and Dr. Hui, for joining us on this conversation and dialogue on the significance of Omicron and how that may be impacting health systems around the world. Certainly, time will tell in terms of how severe this newest variant may be. Thank you all for joining us. And that will wrap up this edition of Dialogue here on CGTN. I'm Michael Wong here in Beijing. We'll see you again next time.